I first came to see Dr. Sammour for chronic left leg problems, just a lot of pain behind the knee, and this has been a condition that has been plaguing me for more than 10 years. Okay. Dr. Sammour, first of all, did a very thorough, I felt, intake of information. I was very impressed with the fact that he takes a holistic view to what your interests are. He didn't write me off as being a 70-year-old to deal with the pain, it's just old age. He very much listened to my goals of doing some very long distance hiking. So after he thoroughly first took information intake and did a physical exam, I was given some exercises to do, but he also treated my, at the moment, intense back and knee pain with an injection. And I believe that was in January of over a year ago. No, it was in March of 2013, and that lasted, did an excellent job for almost a year before it recurred. And as I said, this has been an ongoing problem for over 10 years. Well, when I returned then in January of this year, he not only gave me an injection once more for cortisone, because the problem I have in my left leg is also nerve-based, so it travels around, and I had a returning pain that had traveled more to the upper thigh area. So he gave me a cortisone injection at first to treat the nerve part, and then 3 days later I returned and had lidocaine injections as well. It's been just a phenomenal release from the problems that I've been having. So far so good. After the injections then, I have had much increased flexibility, very little pain. I'm right now actively working up to doing 250 miles of the 500-mile Camino in Spain in a few months. So I've been able to get up to the 6-7 mile mark without, so far, and I need to get up to 12 a day. I've been able to do that pain-free. So I'm very excited about the prospect that I'm actually going to get the leg issues under control and be able to do the things, particularly this long hike coming up, that mean a lot to me. I have been so impressed with the office staff from day one walking in. Every single member in this office has been pleasant, very professional, courteous, and really caring about the individuals, and I've just not found that. In fact, the one other time in my living here full-time since 2002 in Florida, only one other time I had tried to establish with a local doctor here, instead of going back once in a while to my northern doctor, and that early experience was not good. And it's just been so opposite in this situation. I would just thoroughly recommend everyone in the office, from the doctor to every single staff member here. The recent times that I've been coming in to see Dr. Sammour have been for specific treatment of the leg issues, but I've also decided to use Dr. Sammour as my personal physician. And the primary reason for that is that, you know, while doing the normal tests and everything, he doesn't push a prescription fix to things. You know, that he really looks for lifestyle changes, things that you can do without invasive medical procedures. I just really feel like he has an excellent approach that works for me. Non-prescription pushing, overall health, a main concern, and I really appreciate that.